Honourable Speaker, sir, I beg to move the motion of amendment to the motions of thanks to the Governor's address, sir. Sir, but regret that the Governor's address fails to mention regarding the failure in maintaining law and order in the state, regarding measures to improve safety and security of women and children, regarding the problem of unemployment, regarding the problem of drug menace in the city, regarding problem of border areas, regarding the problem of education sector, regarding the problem of health sector, regarding problems in tourism sector, regarding plight of farmers, regarding the need to increase medical and engineering seats in the state, regarding traffic congestion in the state, regarding problems of influx in the state, regarding waste management problem in the state, regarding illegal toll gates erected across the state, regarding water supply problems in the state, regarding problems of forest and environment, regarding problems creation of new civil subdivision, regarding problems of muster rolls, and regarding banking system in the state, sir. Honourable Speaker, sir, I'll be raising certain important issues which were not satisfactorily incorporated in the speech of the Honourable Governor. So law and order is directly linked to development, and the development can be achieved when there is productivity, which results from a peaceful environment. In a state like ours, there will always be incidents of breakdown of law and order, agitations, and so on in different pockets of the state. Now, why and how and what causes such incidences is a question that we need to ask ourselves. What kind of interventions have we come up with to tackle these incidences? So, unless peace and security prevails, there will be no development in the state, sir. We have seen all through the last year how one unfortunate incident in the death of Sri Cheristafil Thankyou led to an unrest for many weeks in the city. And again, after this incident, there was also one recent IED bomb blast in the heart of the city on the 30th of January 2022. This has put the citizens of the state in the sense of fear and panic, sir. The government needs to understand the underlying causes of our youths joining the militancy outfits. Sir, it is encouraging to hear that our brothers in the HNLC have expressed their willingness for unconditional peace talks, and we appreciate the government's reply to the peace talks. However, what worries me most is, what if the peace talk fails? We do not want to see the talks with the HNLC to be derailed. The most pertinent question of the day that we need to ask ourselves is this: why have most of our youths turned to militancy? This is the burden of the government, the frustration and anger felt in our youths due to unemployment. The dissatisfaction of our youths in the policies, in the interventions with regards to employment and education, is a concerning matter. Therefore, urgency to address these issues will automatically solve the issue of law and order in the state. Sir, the rise in the number of uneducated youths, with the rise with the educated youths and with the rise of unemployment is a trigger that needs to be addressed, sir. Now I'll go to education, sir. Respected Deputy Speaker, I would like to quote Nelson Mandela here, who once said, "Education is the most powerful weapon which you can use to change the world." Now, change is inevitable, but positive change is what we should aim for as a state. This can only be achieved through the education, and education should be a holistic approach to molding the character and determine the future of an individual. Education has the potential to bring social change. It is a foundation to physical, mental, emotional, intellectual, social, and personality development. The ability to bring such change depends on every teacher and the infrastructure so that quality education can be attained by everybody. Sir, according to the Performance Grading Index of 2019-20, Meghalaya ranked at the lowest. The score was derived using databases on parameters such as access, equity, governance, processes, infrastructure, and facilities. And this problem continues to be the same, showing no improvement in the following year, 2021, especially with the event of COVID-19 crisis, where a number of students had dropped out due to irregularity of classes, digitalization of education, and in rural areas where internet connectivity is low, it has demotivated many students to attend online classes. Our SSA teachers are living off debts as the government do not pay them regularly and their salaries have been pending for months. They are seen protesting on the streets, demanding for their rights and sending reminding letters to the state government through the Secretary of the Education for payment of salaries from time to time. The Fourth Teachers Association had also put forth their grief by sending a letter on the 4th of March 2022 to the Honorable Governor's Office, as they have not been receiving any answer from the government regarding their memorandum on equal pay for equal work. Their demand for regularization of their post and a hike in their salary as their work experience is the same as the SSA teachers. So this issue has been raised since 2017, and our teachers are anxiously waiting upon the government to meet their requirements immediately. The Meghalaya government has allotted rupees 980 crores to the state education sector as part of its annual budget 2020-2021 to improve the standard of education, focusing on improvement of infrastructure and construction of 200 elementary schools and 8 secondary and higher secondary schools, and the construction of the Eklavya model residential schools, which the government still need to provide information on their status of the progress. The construction of such schools will increase quality education in the future. However, the government need to meet the needs at the present in providing infrastructures as promised. Sir, the midday meal scheme, now called as the Prime Minister Poshan, will cover students from class 1 to class 8 in government and government-aided schools across the country. Now, sir, the load of the midday meal is on the cooks who are supposed to cook the food But these cooks have not been paid, sir, regularly, and their payment is still pending. Now, if the cook does not get paid regularly, how do we expect that he or she will be doing justice by cooking the meals for the children? So despite Meghalaya being one of the most popular education hubs in the Northeast, most schools in the rural areas witness a different reality altogether, sir. In most cases, such schools lack basic amenities and infrastructure required for their proper functioning, sir. Exemplifying the struggle that is faced by the children and teachers, there are two schools in my constituency, sir. One in Lalpani and the other in Betkora. Both these are government schools, sir. But they do not have roofs, and they do not have windows, and they do not have furnitures. This is one example, I'm just giving it to you, sir. These schools have been in the state for years, showing the apathy that the education department has towards primary education, especially in rural areas. So I come to the safety and the security of women and children, sir. So as we all know that in a matrilineal society like ours, the lineage is traced through the maternal lines of the female members of who are the property holders. Hence, there is a misconception that women in our state are empowered. There needs to be a holistic development in the state, and I feel like the first step towards that is to address the women's issues. So women's safety is the most pressing development issue because the development of the state cannot advance forward without the contributions of the female population. Meghalaya is an ideal state that is respected by other states for empowerment initiatives. However, we still witness various reported and unreported crimes against women. The data by the Meghalaya Police, crimes against women in 2019 was 293, in 2020 was 606, and in 2021 from January to September was 492. The NHFS data also shows that women are not empowered, especially in rural areas. Women who continue studies after class 10 show a disappointing percentage at only 35%, sir. One of the factors to address women's issues is to create awareness of the prevailing issues, but the awareness should not just be confined to women only, but we should also include men in the fight for violence against women. The Government of India has passed many laws to provide safety to women in the country, but as we have observed that most of the people residing in the state or society have very little knowledge about the laws relating to women's safety. This issue needs to be addressed and changed. We need to have awareness programs on laws and issues so that women will be equipped with the knowledge to stand up for their rights. Sir, the next topic I'm coming is on the drug menace in the state, sir. I would like to raise a very critical issue on this that is ongoing in every district of the state, sir. The rise of substance abuse and drug users in the state has increased drastically amongst the youth of our state, putting the future of the state and the country at a very critical situation. Drug use and the drug addiction has a clear linkage to increase and wide-ranging health concerns such as cardiovascular disease, stroke, cancer, HIV, AIDS, and so on. From the security point of view, drug trafficking is the largest international crime in the world, deeply connected to other categories of transnational crime, such as money laundering, illegal immigration, human trafficking, arms smuggling, narco-terrorism. Many such concerns have come up, even in our state today. In 2019, a study conducted by the Ministry of Social Justice and Empowerment in collaboration with the National Drug Dependence Treatment Center and the All India Institute of Medical Sciences, New Delhi, showed that Meghalaya has identified 11,420 injecting drug users. These are the number of the drug users who had received their treatment in the state, although there are many who are still untraced. Indeed, the increase of drug users is another pandemic that requires immediate intervention from the government before it tears our family and the society apart. I would like to suggest to the government that opioid substitution therapy, which is normally called as OST, should be set up in every CHC at the earliest for immediate medical aids. Every CHC should have a separate detoxing center, and our state requires a state-run rehabilitation center, as the private rehabilitation centers are too expensive. The state requires more trained professionals, medical psychiatrists, and non-judgmental professionals who will be the frontline workers to alleviate the increase of substance abuse. Schools and colleges will need counselors, as the number of the new drug users are mostly adolescents and school-going children. So, I'm coming to the health sector now. The budget allocation of the health and family welfare in 21-22 was rupees 820 crores. However, our government's hospital does not have sufficient doctors and nurses in PHCs and sub-centers. Deputy Speaker, sir, I would like to inform you that in my constituency, in the Dangar PHC, there is no doctor for the last 10 months. This doctor had resigned in the month of June last, and till date, sir, not a single doctor is available. And no doctor has reported for duty. Sir, I appreciate the efforts made by the National Health Mission for recently coming with a new initiative to address this issue by setting up an online portal for free medical consultation known as the teleconsultation by using Isanjeevani app. But sir, this is of no use for our rural areas due to the connectivity problem, sir. However, the objective of the government, the objective of having a government hospital which is beyond free consultation, it includes providing entire medical assistance to a patient, from providing medical treatment and medicines. If medical treatment is confined to only doctor's consultation, then what good can it bring if at the end of the day, our poor patient still have to go to the pharmacies to buy medicines? Our CHCs, PHCs, and sub-centers have inadequate drug supply and poor stock maintenance. Besides the shortage of doctors and nurses, we also have shortage of anesthetists, medical lab technicians, then we do not have phlebotomists, we do not have histology technicians. So the most common example would be during the case of emergency of lower segment cesarean section, which we say LSCS. These patients are being referred to private hospitals due to the shortage of doctors and anesthetists in government hospitals, thereby making the healthcare expensive and many other expensive medical equipments have been purchased for efficient healthcare services by the government. But sadly, sir, they have not been installed and utilized for several years due to shortage of medical professionals. The state has simply been spending money on resources that are made non-functional, sir. Timely salary to health workers has also become an issue in the sector. One of the key components of the National Rural Health Mission is to provide every village in the country with a trained female community ASHA, or the accredited social health activist. But however, sir, these efficiently trained ASHA workers are seen marching in the streets now, demanding for due payment from 2020 and to increase their minimum wages from rupees 66 per day to rupees 300 per day. This is a great insult to the worker that the NHM could not meet their basic minimum wage, sir. As per the data releases by the Indian Council of Medical Research, National Center for Disease and Informatics in 2021, Meghalaya ranked second in the country in terms of cancer prevalence among men, and it ranked 11 in terms of cancer occurrence among the women. Government had planned to set up a cancer hospital and provide good training and education on cancer for youths in the field of medicine, paramedicine, and nursing. Today, even with the highest ranking of cancer patients in the state, the government has failed to set up the cancer hospital in spite of the assurances that was made. Now I come to the creation of civil subdivision, sir. So a subdivision is an administrative unit that is ranked below the level of a district. A decentralized system such as this could affect all spheres of society, from the nature and quality of governance to the overall well-being of the people, sir. The outcomes in terms of democracy, efficiency, accountability that could be achieved depends greatly on how decentralization is implemented. These administrative units provide varied public services such as maintaining of law and order, electoral affairs, providing civic amenities, general monitoring of all developmental schemes. More generally, a civil subdivision could mean bringing administration closer to the people. It serves, and to that effect, is able to be more responsive to their needs. This involves a transfer of power and responsibilities of the administration from the district level to the subdivision level. Subdivisions can particularly be useful in cases of geographical disconnects. Mr. Deputy Speaker, sir, I would like to inform you that I had also requested that the government for a creation of a new civil subdivision in Mawsynram several times. As the distance of Mawsynram from the headquarters, that is Shillong, is about 65 kilometers, and with a travel time of 2 hours, and the distance from the international border up to Shillong is beyond 100 kilometers. A civil subdivision could be convenient to ease the cost that is incurred if one of the vast populace of Mawsynram were to require services from a faraway headquarters, from a faraway place to the headquarters. So I'll come to the banking sector, which is very important, sir. Development of internet banking in rural areas is an essential part in enhancing the service delivery in the banking sector, sir. Due to poor network connectivity in the state, people in rural areas face difficulty in getting access to online or e-banking services. This leads to a lack of opportunity for people, especially in unbanked areas, to reap the benefits of digital banking. Considering the small number of banking institutions in rural areas, access to internet facilities will help in promoting e-banking services. Good network connectivity will lead to an interest in bringing more awareness about internet banking and increase the usage of e-banking services. An explicit example is during the pandemic, when students, especially in rural areas like Mausinram, were hampered as they were not able to attend online classes due to poor mobile network connectivity, and their parents had to rent houses in Shillong city to keep up with the new educational system. Financial inclusion is an essential aspect to uplift the lives of people in rural areas by ensuring access to credit. Rural enterprise should be encouraged across all sectors like agriculture and the allied sectors like fisheries, textiles, tourism, and so on. Livelihood opportunities in the rural areas will aid in improving the standard of living of the people. This can be achieved by overcoming the challenges in the implementation gap in the existing schemes. So financial education is required not only to help the people understand the importance of savings in a formal institution, but also to help people understand how to leverage financial institutions to affect change in their lives. So the COVID-19 pandemic has taught us important lessons. One of those being the need for an emergency fund at the household level. This provides an opportunity to generate more interest in internet banking, which cannot be achieved without first increasing the bank account registrations in rural areas. And therefore, more banks are required to be opened in the rural areas of the state. So I come to border areas. Deputy Speaker, sir, it is quite surprising that no funds have been received by the state government for the last 2 years under the BADP's program, sir. I do not know whether it is the fault of the state government for not submitting the required utilization certificates or some other reasons, but I must say that the border area development has been hampered and all proposed projects are in a standstill position right now, sir. The people living in the border have been deprived of various kinds of development that the BADP would have provided, sir. But at the same time, sir, I would like to thank the Honorable Chief Minister and his government for taking care of certain projects like from the state fund by constructing the roads and bridges all along the international border in my constituency. I'll be even more grateful if the Kasimara Bridge construction is sanctioned within this calendar year, which will be of great help and benefit to the people of my border area, sir. I'll come to agriculture, sir. Sir, the plight of the farmers now, sir. I appreciate the step taken by the government to provide financial assistance of rupees 5,000 to each farmer under the Focus scheme. But may I ask the government, what happens to the farmer after the rupees 5,000 is exhausted? Will the government be able to handhold the farmers after that? What steps the government is taking to support these farmers so that the encouragement they received under Focus is not a waste? During the pandemic and the lockdowns, the worst hits were the farmers. They are yet to rise to the level where they were before the pandemic. The price of cabbage, potato, tomato have gone down drastically. The price of urea was rupees 450, and now in the open market it costs 1,800, sir. The government's intervention is required to provide the minimum support price to help the farmers. So lastly, I'll come to the traffic congestion. So traffic has been one of the most major concern, and the traffic congestion has impacted the delay of work, business and schools. With the same narrow roads that have not been changed for the last 20 years, Shillong is now reeling under the pressure of daily traffic jams, sir. So much so that the Meghalaya High Court has sought a response from the state government on measures to address it following a PIL. So traffic management needs to focus, as it is one of the most the biggest drawback for tourism footfall, sir. One example for traffic solutions that I can share or can give to the government is by shifting the administrative offices to the new township and widening the present roads. Government needs to create a committee on traffic management and construction of new roads. Traffic congestion is just not in Shillong alone, sir. The traffic congestion has also been experienced in Tura, in Jowai, and in the upcoming towns like Nongpo and Nongstoin as well, sir. And therefore, sir, with these words that I have submitted in front of you and the August House, sir, I hope that the government of the day will examine the observations made in the motion of thanks of the governor's address and duly take necessary steps to address these problems. Thank you, sir.
Thank you.